We know maternal mortality is increasing in the United States, and we know that there are significant racial and ethnic disparities. We know African American moms in particular are dying at higher rates than white moms. In our study, we examined racial and ethnic disparities in severe maternal morbidity, which it is the need to undergo a life-saving procedure while you're in the hospital for delivery, and that affects about 60,000 women per year in the United States. We really wanted to understand disparities not only in maternal death, but in near misses for maternal death. And we found racial and ethnic disparities across all categories of minority women examined. And we found that the largest disparities existed among women with pre-existing chronic conditions, particularly among women with multiple chronic conditions. Some of the conditions we examined included asthma, hypertension, diabetes, substance use disorders, and we found higher rates of many of those conditions among racial and ethnic minority women. But in addition to that, among women who had certain conditions, still even greater disparities among racial and ethnic minority women. We also found that disparities in severe maternal morbidity were largely driven by blood transfusion, higher rates of blood transfusion among racial and ethnic minority women, which may be in part be driven by disparities in the treatment of postpartum hemorrhage. One gap in the literature is that care for certain conditions beyond pregnancy, either before you're pregnant or in that first year postpartum, involves looking at insurance coverage. And I think an important area for future work is to think about disparities in insurance coverage that affect reproductive age women beyond just their pregnancy.